If you're a first-time expectant parent and you know pretty much nothing about breastfeeding, you're in the right place. If you feel clueless or even anxious about how to get started with nursing, I'm going to share 4 of the most important things you should know to get started. Hi, I'm Kate. I'm a Baby Registry Certified Consultant, a Lactation Educator Counselor, and a mom of 2. I help first-time parents feel more confident about their baby gear and registry and breastfeeding, so you can head into postpartum life feeling more confident. With my first baby, I struggled so much with breastfeeding. I was overwhelmed and in pain. But with my second baby, I was confident and everything went much smoother. I've exclusively nursed and pumped for my baby for a year and counting. I'm going to teach you some of the tips that made a world of difference for me. Now, let's get into it. First, let's take a quick step back to understand why breastfeeding is so hard for so many parents. I have a question for you. How many times have you seen breastfeeding happen up close? Under a cover doesn't count. If your answer is 0 times or maybe 1 or 2, you're in the majority. Most parents in the US have never seen breastfeeding happen up close. This is the case for multiple reasons, including the sexualization of breasts, which have driven many parents to breastfeed in private, and the generational loss of breastfeeding knowledge that has occurred over the last 100 years. But the truth is, breastfeeding isn't an automatic instinct for birthing people. We're meant to learn how to breastfeed our babies from repeated exposure over the course of our lives. We're supposed to see our friends and neighbors and family do it out in the open. Of course, it makes sense that so many parents struggle with breastfeeding when the first time they see it up close is when they're doing it with their own newborn baby. The good news is, learning a few fundamentals can go a long way in helping you reach your breastfeeding goals, whatever that looks like to you. Here are a few things you should know. Number 1, your baby will need to nurse very frequently, a minimum of 10 to 12 times a day, and often more. Babies have teeny stomachs, and the nutritional makeup of human milk is such that it's designed to be fed to babies very frequently. Nursing your baby very frequently is the best way to avoid a whole slew of problems like low milk supply, engorgement, plugged ducts, and mastitis. Number 2, position your baby upright to help avoid nipple pain. Many new parents experience nipple pain, and one of the major reasons is due to positioning. Poor positioning can also lead to your baby not being able to get milk effectively. Many parents position their babies across their laps, but this position can lead to nipple pain. One position to try is an upright position, which is what we see in nature. In the upright position, your baby has access to the reflexes they use to latch on and nurse effectively. More on this in a minute. Number 3, learn how to tell when your baby is swallowing. When my first baby was born, I thought he was doing a lot of nursing. Turns out he was just chilling on my boob. He was moving his jaw around and suckling, but not actually getting milk. Learning how to tell if your baby is swallowing is a great way to ensure that they're getting enough milk. Knowing if your baby is swallowing is also a good thing because it can help keep your nursing sessions efficient so you're not sitting there the entire day with your nipple in your baby's mouth. Number 4, learn the signs breastfeeding is going well and when to reach out for help. After your baby is born, your pediatrician should closely monitor your baby's weight. If your baby is gaining weight according to their growth curve, that is a good sign that your baby is getting enough milk. You can also count your baby's dirty diapers as another piece of the puzzle. If your baby isn't gaining enough weight or you're in lots of pain, that's a sign it's time to get personalized support. Reach out to an International Board Certified Lactation Consultant, or IBCLC, for help. These are the lactation experts with the highest credential. Pediatricians are not lactation experts. They get very minimal lactation training. IBCLCs can help you with lots of things. Milk supply, nipple pain, pumping, bottle feeding, the list goes on. Reach out for help early. Challenges with feeding can snowball quickly. I learned this firsthand with my first baby. So please reach out for help early and often. Many US insurance plans cover IBCLC visits, so check with your provider. If you want to feel more confident as you prepare to welcome your baby, I lead a class called Baby Gear Bootcamp for first-time expectant parents. In just about an hour a day over 5 days, you'll learn exactly what baby gear you need, what's optional, and what you can skip. More importantly, you'll learn how to use your baby gear in a way that respects your baby's development. You'll also learn how to breastfeed, pump, and bottle feed with videos led by an amazing lactation consultant. You'll learn more about everything I talked about today, including milk supply, proper positioning to avoid nipple pain, how to tell if your baby is swallowing, how to tell if breastfeeding is going well, and much more. It's all of the info that helped me go from struggling with my first baby to thriving with my second. The class is just a few hours, but it demystifies the fourth trimester so you and your partner can start your life as parents feeling more confident and less stressed. You may think, this sounds pretty good, I'll come back to it later. Don't procrastinate because, and no judgment, but you probably won't come back to this later. Even if you take away just 1 or 2 little nuggets from this class, it can be a game changer for postpartum life and how you feel about yourself, your baby, breastfeeding, and your new life together. And I promise you will take away many, many nuggets. Don't wait. Go to this link now or click the link in the video description for more. Thank you.